Hello student. This is the second part for the treatment and nursing for patient with acute heart failure. Treatment focuses on maintenance hemodynamics and reducing excess fluid. 1. Dry and warm found about 25% of CHF patients. Treatment will only adjust their oral medication. 2. Wet and warm found about 50% of patients. The therapy will be considered according to blood pressure levels. If BP is good, vasodilators and diuretics will be given. However, if there is excessive fluid, diuretics must be given immediately. In some cases, temporary dialysis may be required to remove fluid, along with vasodilators. 3. Dry and cold, found only 5%. Therapy will be given fluid or inotropic agents such as dopamine and dobutamine, which will be stopped immediately if perfusion improves. Finally, 4. Wet and cold found 20%. Management will be considered according to blood pressure level. If the systolic BP is greater than or equal to 90 mmHg, consider giving inotropic drugs to help contractility in cases that do not respond to treatment refractory cases, and giving diuretics. But if the systolic BP is less than 90 mmHg, give inotropic agents in all cases and vasoconstrictors in cases that do not respond. Give diuretics when perfusion improves. In cases that do not respond to medication, consider inserting a mechanical circulatory support device (MCS). Summary: the treatment for patients with acute heart failure include diuretics to decrease congestion or preload, vasodilator to reduce preload and or afterload, inotropic to increase contractility as well as using MCS. Mechanical circulatory support. There are several types of MCS. Firstly, the intra-aortic balloon pump IABP, as the insertion of a balloon into the thoracic aorta that manages to inflate and deflate in relation to the heartbeat, reducing afterload and increasing blood flow to the coronary artery. Newer machines such as Impella CP, which uses a tube to suck blood from the left ventricle and place it directly into the aorta. Tandem heart, or ECMO, are machines that help the heart contraction by taking blood and purifying it outside the body and then putting it back in, similar to the operation of a heart-lung machine. After maintaining sufficient hemodynamics, the cause is corrected and the triggers are controlled, such as coronary angioplasty and acute coronary syndrome, with the outcome monitored, i.e., life-saving, preventing complications and disability. The important nursing diagnosis including risk for low cardiac output, ineffective gas exchange, hypoxia, excess water and psychological problems. Emphasis on monitoring complications by monitoring vital signs. Listening to lung sounds, arranging for elevated head of bed. Sometimes using an overbed table. There is an innovative table called a moon table that makes patients comfortable from pulmonary edema. Ensure adequate oxygen intake, either without intubation or with a ventilator. Administration of various medications, including inotropic agents, as they are high alert drugs with different effects in different doses, and diuretics, as shown in the slide. Assessment of fluid intake and output. If urine is less than 0.5 ml/kg/hour, acute renal failure may occur. The team should be notified. Restrict fluid intake according to the treatment plan, both intravenous and oral fluids. If patient retains NG tube, nurse must be calculated to the amount of fluid in each meal. Finally, support mental care according to the slide. Nursing care for patients with acute heart failure requires carefulness and speed in nursing and treatment. Students will receive decision-making training from the classroom and workshops. If you have any questions, please feel free to ask via email or discussion in e-learning.